Back with more of the Cardinal Insider, coming to you as always from the Commonwealth Credit Union studio. If you've been listening to the show, you know Commonwealth Credit Union, proud sponsors of the University of Louisville. Also a proud corporate partner of the University of Louisville is KORT Physical Therapy. They are the official rehab provider of the Louisville Cardinals. And to talk more about KORT Physical Therapy, we're going to talk with Jon Beougher here from KORT Physical. Jon, how are you doing?
I'm doing great.
Let's talk about, I think now everybody has a specific plan in place. There's obviously strange times. Let's talk about the safety precautions that KORT is taking at this current time to keep patients and employees safe here.
Yes, so we have three options for patients that are wanting to receive care from us. So if you're out there and you're hurting, or you've had a surgery and you haven't finished recovering from it yet, or you've got a surgery coming up later this year that you want to get ahead of, we have three options for you that are going to follow all the safety precautions that the CDC and the state are asking us to do. So option number one is we're allowing people to come on into our clinics. So you can go to KORT.com. There's no referral needed. You can live chat with us 8 to 5, Monday through Friday, or you can request an appointment online. And we have several precautions that we can talk about in a second that we go through when you come into the clinic. But the second option for people that don't want to come into the clinic or feel comfortable with that yet is we can send a patient therapist out to your house. So one of the things we're doing is in-home therapy, where a therapist can come out and provide one-on-one treatment to you there in your house. We can go through and assess your pain and how you're moving and how to figure out using what you have in the house already to come up with some effective exercises to help your pain and help you move better. And option number three for people is also going to be the TeleRehab option. So we've been doing quite a bit of the TeleRehab, and that's something that allows for us to connect with you via a laptop, a tablet, or a smartphone. So there's no human-to-human interaction at this point, but we're able to get in on that platform and really assess what's going on, listen to your concerns, talk with you, watch you move, and figure out how to help you. So all three of those options are available for people that are looking to get essential care for their pain or for their difficulty with moving.
There's so much talk these days about that TeleRehab option. I wanted to ask a little bit more about that and just kind of maybe, if you could, dive a little bit deeper into how that is benefiting patients right now.
Yes, the response from our patients that have been receiving the TeleRehab has been fantastic. They've really enjoyed having this as an option to get face-to-face, one-on-one care during this time. One of my patients had knee replacement surgery right before all of this started, and so he was still in the process of recovering from surgery and wasn't quite sure what to do. He wasn't sure if he should still be trying to go to the clinic or have someone come to his house, so we settled on that TeleRehab option. The cool thing about TeleRehab, I was able to be measuring his knee digitally through our software and through our system, so I was able to see exactly how well he was bending and straightening, and that allowed us to adjust his exercises based on that. I was able to watch how he was walking around the house and standing up and sitting down from a chair and climbing stairs, and that really helped us determine the best way to get his strength exercises going in ways that weren't going to be painful. Another patient actually was a patient who was recovering from coronavirus and had come home from the hospital, so we utilized TeleRehab to go in and assess how the patient was moving, assess specifically the breathing, and we were able to implement and teach a lot of breathing techniques that were really helpful and help that patient start to understand the appropriate amount of exercise and activity to be doing.
Well, so you guys have actually had experience with a patient who is recovering from the coronavirus. That's and how did that whole process end up working out? Was there any sort of other unique steps you guys had to take with that particular client?
So, yes, that was why we utilized the TeleRehab option, and we're going to have some more options coming up as it relates to treating the patients that are recovering from coronavirus. But at this point, that patient we saw via TeleRehab, and he did awesome. He did great, and then he after he was past all of the CDC guidelines, he was now going to be eligible for in-person care. One of the things that we're doing with that, with our patients that come into the clinic, we've got several safety guidelines set up to make sure we're keeping everybody safe. So if you're a patient and you're experiencing pain and you want to come to one of our clinics, we'll just walk you through what that would look like. You go on our website, KORT.com, request an appointment. At the time you request that appointment, we're going to go ahead and screen you with the CDC guidelines, make sure everything's safe. On the day of your appointment, we're going to screen you again. You show up to the clinic, and you go ahead and just call us when you get there. We're going ahead and closing our waiting rooms to make sure that we keep all the social distancing intact. We're going to be asking all of our patients to wear face masks because all of our staff's going to be wearing face masks as well while we're in the clinic. When you walk in the clinic door, we're going to give you some sanitizer for your hands. If you do need to sign any forms, we're going to hand you a freshly sanitized pen to do that. Your entire time in the clinic is going to be one-on-one with your therapist, so we can make sure to engage in appropriate social distancing and give us plenty of time to keep everything clean while we're in the clinic. So that's something with all the safety precautions we're taking in the clinic and in the home care, we're able to make sure we're keeping everybody safe.
So it sounds like the prevailing theme here is if there's a person out there listening who's experiencing musculoskeletal pain and is thinking maybe I don't have options because of the state of the world right now, not the case. KORT has plenty of options for you right now, correct?
We have plenty of options. So if you are still wanting to have no contact with people at this point, that TeleRehab option is great. It's helping a lot of people. Go to KORT.com, request an appointment, specify you want telehealth, and we'll make it happen, and you'll see the benefits that you can get from that. Or if you feel more comfortable receiving care in your home, let us know and we'll come there. Or if you'd like to come to our clinic, we've got all the precautions in place to keep you safe.
Again, KORT.com for all your information. You can connect with them there. Jon, anything else you'd like to say to the people listening here before we call it a show here?
Just to let you guys know, we're here to help. If you're hurting or you're recovering from surgery or you're about to have surgery or you just want to move better, get on KORT.com, request an appointment.
There you go. Jon, thanks so much for spending some time here with us on the Cardinal Insider.